Keegan, the Member of Parliament for Chichester, and I'm here today with the wonderful Dr. Jane Padmore, and we are together at the Swandene Mental Health Hospital site in Worthing, and that serves the whole area. But we've got some new units in, new wards, which are dementia wards called Forget Me Not. So I was having a look round and looking at the fantastic work they do here. But we've also had an interesting chat, Jane, about how you got involved, you know, the start of your career.
So I started back in 1989, it was a very long time ago now, as a healthcare assistant, having failed my A-levels quite badly, not doing very well at school, not really knowing what I want to do. And to be honest, my mother's friend saw an advert in the bin that was for a healthcare assistant at a local home for people with learning disability and said that would really be good for you. And I thought, oh, nothing to lose, I don't know what else. I'd done a bit of voluntary work with people with learning disability, and I applied for the job and got it and absolutely loved it, and found that I'd found my home and the career I wanted. And within weeks they said to me, why don't you do your nurse training? I did a certificate in nursing, and which was the majority was working on the wards with a day a week in college every week. And just loved it. I'm so passionate. I've done 10 years in adult mental health and 15 years in child and adolescent mental health, and then eventually became the chief nurse in Hertfordshire, and then moved here to be the chief nurse for about 16 weeks before I became the chief executive here. And I absolutely love it. I feel I found my home in Sussex. It's a beautiful place for people to come and work.
So how's the integration going? Because obviously we want to focus on prevention, community, but that means a lot of bits, not just the NHS, but other things working together as well. How's it going? So
I think it's a work in progress. I think it's a really exciting time to be a chief executive in the NHS. Historically, we've been about internal markets and bidding for services and stuff, and this move to thinking about population health and working in partnership with the other trusts and the other health and social care services, but also the voluntary sector in a different way in Sussex is just exciting, and I think it opens up a whole new world, but it's got to be based on relationships. So one of my primary focuses is on building good relationships and trust, so that we're and a joint understanding of we do what's best for the person that's in front of us and the population, not necessarily what's best for the organisation.
That's a huge shift.
It is, and it's a big shift. But I think the rewards are really exciting, and the rewards for the people that we're here to serve I think they'll grow with time. Yeah. There'll be bumps along the way, and there are challenges, and acuity, the demand for our services and the level of need is really high. But what I'd say is, if we carry on doing what we're doing, we're not going to ever meet that demand. We have to think differently. We have to think differently about the workforce. We have to think differently about our model. We have to think differently about accessibility, and we have to think differently about how we work with patients and their families.
It's so good to hear that, because sometimes when you're sat, in a ministerial position and looking for what we all can see would be the right way, but how you get people to feel confident and comfortable enough to work in that new way. I think we've got some fantastic leaders across Sussex as well, so I think that also helps. One of the things I was really interested in before was when we were talking about the sort of more of a creative approach to trying to solve the workforce challenges and trying to encourage more people to give mental health a try, as it were. And you had a really interesting idea around students, which I think is fantastic. So just explain what that is.
Yeah, so it is, I will declare an interest. It's based on my daughter's experience, who's studying law at Liverpool University. And I suggested she joined our bank so that she could do shifts here. So she spent the summer doing her mandatory training. She did about 12 shifts on the wards, and then she went off to university. But what that's meant is, one is that when she comes down at Christmas or for the weekend, she can do 1 or 2 shifts. She can just pick up a shift, and she can earn some money without having to apply for a job or without having to do anything. But the other thing it's done is she's really interested in law, but now she's interested in social justice, and she's interested in the Mental Health Act, and she's interested in public law, whereas before she was interested in criminal law. So it's opened the world to her of mental health, learning disability, health service and public service that maybe she would never have seen before, at the same time as giving her the opportunity to earn money. When there's a student, that's really quite important.
Very much so. That'll look brilliant on a CV. And I think the proposition is mandatory training for 2 weeks, which you get paid for.
Yes.
Then you've got complete flexibility. There's tons of roles you can do. Everything from a chef to a healthcare assistant to keeping the place clean and tidy to working with the
administrative work, all sorts.
So that sounds a fantastic idea. And I think, you know, would look brilliant on a CV as well, really differentiate. That flexibility, I think, is the key to the future of work. And also giving that the options to learn and discover via the workplace can really shape your career thoughts as well. So that's fantastic. Thank you for everything you're doing.
Right.
You're doing a brilliant job, and it's lovely to see the units here and the fantastic service that people across Sussex and Chichester get. So thank you.
Lovely. Thank you as well.
Thank you.